So I'm going to walk you guys through a shoulder exam. Ideally, our model or our patient would have their shoulders and upper back revealed so we can get an idea of an inspection exam. For the purposes of this video, I'll just explain what I'd be looking for. So first off, once again, I'm looking for asymmetry, level of the shoulders right there. I'm looking for any obvious swelling, bruising, etc. when it comes to the shoulders anteriorly, superiorly, as well as the upper back and the scapulas or shoulder blades. What I like to start with after that is a range of motion exam, so active range of motion. So the first of which right here, as we kind of shift to our model, is we're going to do active abduction. So with our palms facing upwards, we're going to bring them up above our head till they can touch. With palms upwards, you should get up to a full 180 degrees. You're going to bring those down. The next part of it is going to be front flexion. What I normally do is I stand behind the patient, palpating their shoulder blades and looking at them, looking for any evidence of a winged scapula or scapular dyskinesis. So he's going to bring his arms up in front of him with his palms up, and all the way to the top, up above his head. Should go up to almost 180. And then he'll typically, when I'm examining him, slowly bring them down so I can watch what his shoulder blades do. You can bring them all the way down. Next, I'm going to check external rotation. So arms are in like this. He's going to slowly just bring them all the way out. It should be pretty even on both sides right there, at least 45 to 50 degrees. And I'm going to have my model turn around right here. We're going to show you internal rotation. So using just his right arm, he's going to bring his palm back and bring it all the way up. I measure where his thumb is. I would typically compare both sides. What I'm looking for is where does this come in terms of vertebral levels. I'm looking for it to at least come to the mid-thoracic vertebrae. You can see some decreased internal rotation on the dominant side of overarm throwers like baseball or softball players just because of their increased external rotation. You can turn that around right there. Next is going to be my palpation portion of the exam. I start at the sternoclavicular joint. I travel all the way along the clavicle until that next bony prominence, which is the AC joint. Just anterior to that is the coracoid process, and just laterally you'll feel a cord-like substance, which is the long head of the biceps tendon. I will also do some palpation, upper trapezius, medial scapular muscles on the back for the purpose of this video. I'm not going to do them right now. Next, I'm going to check strength, specifically the rotator cuff muscles. I'm going to do the empty can test. We're going to come up in the scapular plane, about 20 degrees towards the front right here. I'm going to bring you up just like that. Flip your thumbs downwards. If the patient already has a ton of pain just like this, I would change it to the open can or full can test with the thumbs up. All we're going to do is have them push upwards. If we have pain or weakness, you want to note that. That's looking for supraspinatus injury or tendinitis. Next is going to be resisted external rotation. So he's going to bring his arms in like this. We'll check one side first. You want to have a little bit of internal rotation right there, about 15, 20 degrees. He's just going to push outwards. And once again, I would compare this to the other side. If you're not sure if there's noted weakness, what you can do is you can bring their arms out further and have them once again push outwards against your pressure, looking for differences on both sides. I'm going to have you turn around again. This next one is called the liftoff test. And just to note that previous test, the resisted external rotation, is looking at infraspinatus and teres minor weakness. So for the liftoff test, we're going to start like we did the internal rotation right there. With his wrist straight, not bending his wrist, he's going to push off against my hand. You're going to compare one side to the next. This is looking for subscapularis weakness or injury. Turn back around first in. He's going to put his palm up in front of him for what we call Speed's test. This is testing for biceps or long head of the biceps tendon pathology, just pushing up. As he pushes up, what I'm looking for is weakness or pain along the long head of the biceps right there in the bicipital groove. Another good test for biceps pathology is called Jurgensen's test. I'm going to set him up like a handshake, and what I have him do is I have him raise his palm upwards against my pressure. So raise your palm upwards. If that causes pain along the bicipital groove, once again concerning for biceps pathology. Another test I really like is called the AC or the cross test, where he puts his one hand on his opposite shoulder. First off, if that causes pain, that's concerning as long as it's over the AC joint for AC joint pathology. The other one is the resisted external force test, where he pushes against my hand, looking for pain over the AC joint, that bony prominence one more time. Another test I like is called O'Brien's test, where I internally rotate him with his thumb down. I keep his elbow straight, and I have him bring his arm across his body with his elbow straight. That's where he pushes up against the ceiling. If he has pain over the AC joint, this could be concerning for AC joint pathology. If he has pain deep in the shoulder along the bicipital groove, that could be concerning for labral pathology, such as a slap tear. Okay. I'm going to have you lie down. We're going to show some apprehension testing right here. So what this is looking for right here is anterior shoulder instability or laxity, depending if there's pain or not. So what I'm doing is I have my one hand underneath his upper arm, I'm pulling upwards this way, and then slowly bringing his arm back. What I'm looking for is there pain in the anterior posterior shoulder, and does he have that feeling like his shoulder is gonna dislocate or it's really loose? If it's yes to any of those, what I do is the relocation test. That's putting anterior pressure over his humeral neck and then doing the same move. This is stabilizing his humerus in the joint right there.